Occupational English Test, Listening Test. This test has two parts. Part A. In this part of the test, you will hear a general practitioner talking with Ms. Lee, a woman with a bladder infection. You will hear the consultation once only in sections. As you listen, you must make notes about the consultation under the headings given on the answer paper. Turn over now and look quickly through Part A. You have 1 minute to do this. You must give as much relevant information as you can under each of the headings provided. You may write as you listen, and there will be pauses during the consultation for you to complete your notes under the relevant heading, and to read the following heading. There will also be 2 minutes at the end of the test for you to check your answers. Give your answers in note form. Don't waste time writing full sentences. Remember, you will hear the consultation once only, and you should write as you listen. Now look at question 1. Question 1 has been done for you. Good afternoon, Ms. Lee, is it? I'm Dr. Jacobs.
Hi, doctor.
So have you been to this medical practice before?
Yeah, I have, yes. Probably about 3 months ago. At that time, I saw Dr. Kuma.
Oh, okay, no problem at all. So what can I do for you today?
I think I may have a bladder infection.
I'm sorry to hear that. Tell me, what kind of symptoms have you been experiencing?
Well, for the starters, I've got a crampy feeling in my lower belly, and I also have some very bad lower back pain.
Okay, well, let me ask you a few questions and we'll try to get to the bottom of it. Now look at question 2. Take notes on Ms. Lee's symptoms and period cycle. Do you remember when the cramps actually began?
I think it was about a week ago, maybe a week and a half. I know it sounds silly, but it's difficult to remember the exact day.
That's okay, just a rough idea is enough. And you sure these symptoms are not related to your period?
Yeah, I finished my last period about 2 weeks ago. I think it was on the 16th, and again, I can't be certain.
Okay, well, I'll have to ask you a few personal questions about that if you don't mind. Are your periods generally normal? Any problems, abnormally heavy with excessive bleeding, or are they prolonged or irregular?
No, they're usually just normal. I mean, I have the occasional heavy day or two, but they're generally very regular.
So what is your typical cycle?
Oh, you mean days? 28 days?
Okay. Now look at question 3. Take notes on Ms. Lee's further current symptoms and problems. Okay, so that's good news then. Do you have any other symptoms currently?
Well, the main thing is that it seems like I have to pee every few minutes. I always seem to have the sensation that I need to go. So it's also making work really awkward these days. I mean, nobody says anything, but I'm sure they have noticed.
That is a common symptom of a bladder infection, yeah.
There's also a slight burning sensation when I urinate, and it's cloudy too. It also has a strong smell.
Okay. And apart from that, is there anything else that you've noticed?
I've also had a bit of a fever for the past few days.
Okay. Have you had any other recent illnesses, a cold or a flu?
No, I've been very healthy.
That's good to hear. Now look at question 4. Take notes on the details of the testing process. Well, all the things that you've described certainly fits cystitis. We can check it out easily enough. I'll give you this sample cup, and if you can take that down to the toilet and bring back a sample, we can try to find an answer for you. But we will need a clean catch, so start the stream first and then get the sample. So midstream, you could say. You don't need much, just half the cup is more than enough.
Okay, no problem. I already feel the urge to go again anyway, so perhaps it's good timing.
Okay, great. The toilet's just down the hallway and it's the second door to your left. Now look at question 5. Take notes on the clinical testing process and findings.
Hi, doctor. Do you think this is enough? Sorry, I think I was a bit nervous, so it took me forever to get started.
That's okay. Yeah, that's certainly a large enough sample. Let me test it with one of these urine quick test strips.
Oh, really? Is that simple? I thought it could take days to find out.
Yeah, this little strip can test a variety of things, some of which are very indicative of a bladder infection.
Maybe I should get some of those.
Well, you can if you like. They're sold over the counter, actually. Okay, let's see what we've got. The nitrates are positive, leukocytes are positive, and a trace of red blood cells. Everything else seems to be normal.
Is that a good or bad thing?
These findings are certainly consistent with a bladder infection. The nitrates are a byproduct of bacterial metabolism, and leukocytes are the cells your body uses to fight the bacteria.
What about the blood?
Blood is sometimes present if the infection is considered sort of moderate to severe. I want to do one more thing. We'll put a little bit in a tube and spin it down.
So what will that do?
That'll concentrate all this cloudy material at the bottom of the tube. We can then stain it and take a look at it under the microscope. There's actually a monitor hooked up to the microscope, so you can also see what's in there.
That sounds like it could be interesting.
Now look at question 6. Take notes on the details of the findings and possible causes. Okay, well, you see all those little things swimming about on the monitor?
Yep.
Those are bacteria, and lots of them.
Those are in my bladder?
Yep, and they seem very content.
Oh my god, that looks disgusting.
There's no need to worry. About 90% of bladder infections are caused by E. coli, which is a very common bacteria and can be easily treated. Women have a far greater vulnerability than men, and it's very common, especially if you're sexually active.
Okay, well, that's good news that it's easy to treat. I'm happy about that part, at least.
Are you currently taking any medications?
Not at the moment, no. I take some vitamin supplements, but that's it.
You mentioned you saw Dr. Kumar before, but are you seeing any other doctor for any other health problems?
No, not really. I only saw Dr. Kumar that one time. I had a regular GP growing up, but since I moved, I haven't been back.
Okay, no problem at all. Now look at question 7. Take notes on the prescribed medication and any side effects. Okay, well I'm going to prescribe you 7 days of macrodantin, which is an antibiotic. While you will need to take the antibiotic for 7 days, the symptoms should be gone, or at least dissipated, in 2 days.
Okay.
You'll need to take the macrodantin 4 times a day, and furthermore you should only take it after meals. Now, I don't want to confuse you, so if you want to write this down it may help. I want you to start it right away. So by that I mean go and grab a bite to eat after you leave here, and get the first one down as soon as possible. You can then take one after dinner tonight, and finally one more with a glass of milk before bed. Tomorrow you can just divide the 4 doses evenly throughout the day. Does that all make sense?
Yeah, that's okay. I understand.
And I'm also going to give you 2 days worth of pyridium, which when excreted has a local analgesic effect, and that will relieve some of the more unpleasant symptoms you've been experiencing. The things like the burning, the urgency, etc.
So there's only 2 days worth. Will that be enough?
I don't think you need more than 2 days of pyridium, as it's basically just used for symptom relief. And apart from that, if you take it for any longer than 2 days, it may actually mask the symptoms.
Okay.
The pyridium should be taken 3 times a day, and it should also be taken with food and at least 2 glasses of water. Now, pyridium will also turn your urine a vivid red-orange colour, so don't be alarmed by that. It is really quite normal. And pyridium will also most likely stain your underwear, basically a similar colour. So I wouldn't recommend wearing anything expensive or white that you don't want stained a lovely orange colour.
Okay, well, that's good to know. It sounds like a lot to take in.
Look, don't worry about it. It will be on the prescription, and you've also written it down as well, so you shouldn't forget. But it's very important you finish the antibiotic, okay? You never stop taking them until the full prescribed dosage is finished, even if you're feeling fine. If you do stop them, you run the risk of the infection coming back.
No problem, I understand.
Now look at question 8. Take notes on the doctor's immediate plans and advice. As I said, the pain should be gone in 2 days, but if the pain persists after 2 days, I want you to call me, okay?
Okay.
I also want you to increase your water intake.
Yeah, sure.
I'm going to send your sample to the lab for a positive ID of the bacteria, It's not likely, but if it turns out to be something other than E. coli, I may want to change the antibiotic you're taking. If that happens, I'll call you and let you know. So if you don't hear from me, you can assume that everything is fine. But I expect everything to be okay, and after 7 days, you should be fully recovered.
Okay, that's great. Thank you.
Now look at question 9. Take notes on the nature of Ms. Lee's work and bathroom habits. So before you go, can you tell me what sort of work you do?
I work in an assembly factory. Why is that significant?
I'm just wondering how easy it is for you to get to the bathroom during the day.
Well, we have to wear one of those white disposable protective suits, so not so easy, I guess. But the work is easy, nothing strenuous, and my co-workers are great.
I'm not worried about the labour part of your job. My concern is that you may not be getting to the toilet as often as you should.
Well, we can go whenever we want, but to be honest, we have to go through the hassle of unsuiting. Then going and then resuiting. It's a hassle, you know. It's a pain, so very few of us bother.
So I'm guessing you go as seldom as possible?
Yeah, pretty much.
How many times would you urinate throughout the day?
I don't know, maybe 3 or 4 times.
And how about at night?
Normally never, but since this started, maybe 3 or 4 times a night.
Isn't it uncomfortable to work, while needing to wee?
We all have a routine. We rarely drink anything before lunch and almost nothing at lunch. If you don't drink, you don't have to go to the toilet. It's simple, but it works for us.
So how much water do you drink each day?
Not much. 2 cups of coffee and a soft drink, maybe.
Now look at question 10. Take notes on the doctor's parting advice. Well, that is a problem. The dehydration and the infrequent urination is the perfect recipe for a bladder infection. If you're going to continue with this job, you're going to have to start drinking and, of course, urinating more normally, or you're going to be in here with a bladder infection every few months. It may be a hassle, but you and your co-workers need to make some changes. If it would be helpful for me to explain this to your boss, I'd be happy to talk with them.
Oh, thanks, doctor, but I don't think they actually mind. It's more about us just not wanting to go through the hassle. But I guess I'll have to just get used to it.
Look, the key is to basically not dehydrate yourself and to urinate when the urge hits. I mean, you can delay for a while, but don't hold it in for an hour or more.
Okay.
And try to drink at least 1.5 liters of water each day.
Yeah, sure, I will do.
Occupational English Test. Listening Test. This test has 2 parts. Part B. In this part of the test, you will hear a talk on Parkinson's disease. You will hear the talk once only in sections. As you listen, you must answer the questions in the spaces provided on the answer paper. Turn over now and look quickly through Part B. You have 1 minute to do this. You may write as you listen, and there will be pauses during the talk for you to complete your answers and to read the following question. Remember, you will hear the tape once only, and you should write as you listen. Now read question 1. Question 1 has been done for you. My name's Dr. Neil Henderson, and today I'll be discussing and hopefully dispelling some of the myths concerning Parkinson's disease. I will go over the symptoms, causes, and also just who is at risk of this pervasive disease. Now read question 2. Now listen and answer question 2. Parkinson's disease is the second most common neurodegenerative disorder and the most common movement disorder. It's characterized by progressive loss of muscle control, which leads to trembling of the limbs and head while at rest, stiffness, slowness, and impaired balance. As symptoms worsen, it may become difficult to walk, talk, and complete simple tasks. Now read question 3. Now listen and answer question 3. While the main symptoms of Parkinson's disease are movement related, progressive loss of muscle control and continued damage to the brain can lead to secondary symptoms. These vary in severity, and not every individual will experience all of them. Some of the secondary symptoms include anxiety, insecurity, and stress. Sufferers may also experience confusion, memory loss, and dementia, whilst the latter is most common in elderly individuals. Other symptoms may include constipation, depression, difficulty swallowing and excessive salivation, diminished sense of smell, increased sweating, and for males may impact their sex life by way of erectile dysfunction. The list goes on to include skin problems, slowed, quieter speech, in often a monotone voice, and lastly, urinary frequency and/or urgency. Now read question 4. Now listen and answer question 4. The progression of Parkinson's disease and the degree of impairment vary from individual to individual. Many people with Parkinson's disease live long, productive lives, whereas others become disabled much more quickly. Premature death is usually due to complications such as falling-related injuries or pneumonia. Most individuals who develop Parkinson's disease are 60 years of age or older. Typically, it's later in life. Since overall life expectancy is rising, the number of individuals with Parkinson's disease will increase in the future. Adult onset Parkinson's disease is most common, but early onset Parkinson's disease, onset between 21 to 40 years, and juvenile onset Parkinson's disease, onset before age 21, also exist. Now read question 5. Now listen and answer question 5. So when did people begin to document the disorder? Descriptions of Parkinson's disease date back as far as 5000 BC. Around that time, an ancient Indian civilization called the disorder Campavata and treated it with the seeds of a plant containing therapeutic levels of what is today known as levodopa. Parkinson's disease was named after the British doctor James Parkinson, who in 1817 first described the disorder in great detail as shaking palsy. Now read question 6. Now listen and answer question 6. The primary symptoms of Parkinson's disease are all related to voluntary and involuntary motor function. When we think of Parkinson's, we generally have one symptom in mind which typifies the disorder, and that is one of tremors. This can involve the trembling of fingers, hands, arms, feet, legs, jaw or head. Rigidity, on the other hand, or stiffness, may increase during movement, producing muscle aches and pain. Further to this is what we refer to as bradykinesia, the slowness of voluntary movement. Postural instability is the impaired or even lost reflexes that can make it difficult to adjust one's posture to maintain good balance. What is distinctive in individuals with more progressive Parkinson's disease, and it is sometimes the initial sign that brings it to the attention of people, is a particular gait. This is a characteristic shuffling walk with a stooped position and a diminished or absent arm swing. Now read question 7. Now listen and answer question 7. A substance called dopamine acts as a messenger between two brain areas, the substantia nigra and the corpus striatum, to produce smooth, controlled movements. Most of the movement-related symptoms of Parkinson's disease are caused by a lack of dopamine due to the loss of dopamine-producing cells in the substantia nigra. When the amount of dopamine is too low, communication between the substantia nigra and corpus striatum becomes ineffective and movement becomes impaired. The greater the loss of dopamine, the worse the movement-related symptoms. Other cells in the brain also degenerate to some degree and may contribute to non-movement related symptoms of Parkinson's disease. Although it is well known that lack of dopamine causes the motor symptoms of Parkinson's disease, it is not clear why the dopamine-producing brain cells deteriorate. Genetic and pathological studies have revealed that various dysfunctional cellular processes, inflammation and stress can all contribute to cell damage. In addition, abnormal clumps called Lewy bodies, which contain the protein alpha-synuclein, are found in many brain cells of individuals with Parkinson's disease. The function of these clumps in regards to Parkinson's disease is not understood. In general, scientists suspect that dopamine loss is due to a combination of genetic and environmental factors. Now read question 8. Now listen and answer question 8. So who is most at risk of developing Parkinson's disease? In most individuals, Parkinson's disease is idiopathic, which means that it arises sporadically with no known cause. However, some individuals diagnosed with Parkinson's also have family members with the disease. By studying families with hereditary Parkinson's disease, scientists have identified several genes that are associated with the disorder. Studying these genes helps understand the cause of Parkinson's disease and may lead to new therapies. As I mentioned earlier, age is the largest risk factor by far for the development and progression of Parkinson's disease. Most people who develop Parkinson's disease are older than 60 years of age. Men are affected about 1.5 to 2 times more often than women, while a small number of individuals are at increased risk because of family history of the disorder. What may also lead to Parkinson's are the less common cases of head trauma, illness, or exposure to environmental toxins such as pesticides and herbicides. Now read question 9. Now listen and answer question 9. An early and accurate diagnosis of Parkinson's disease is important in developing good treatment strategies to maintain a high quality of life for as long as possible. However, there is no test to diagnose Parkinson's disease with certainty except after the individual has passed away. A diagnosis of Parkinson's disease, especially in the early phase, can be challenging due to similarities to related movement disorders and other conditions with Parkinson-like symptoms. Individuals may sometimes be misdiagnosed as having another disorder, and sometimes individuals with Parkinson-like symptoms may be inaccurately diagnosed as having Parkinson's disease. It is therefore important to re-evaluate individuals in the early phase on a regular basis to rule out other conditions that may be responsible for the symptoms. A neurologist who specialises in movement disorders will be able to make the most accurate diagnosis. An initial assessment is made based on medical history, a neurological exam and the symptoms present. For the medical history, it is important to know whether other family members have Parkinson's disease, what types of medication have been or are being taken, and whether there was exposure to toxins or repeated head trauma in the past. A neurological exam may include an evaluation of coordination, walking, and fine motor tasks involving the hands. Now read question 10. Now listen and answer question 10. There is currently no treatment to cure Parkinson's disease. Several therapies are available to delay the onset of motor symptoms and to ameliorate motor symptoms. All of these therapies are designed to increase the amount of dopamine in the brain, either by replacing dopamine, mimicking dopamine, or prolonging the effect of dopamine by inhibiting its breakdown. Studies have shown that early therapy in the non-motor stage can delay the onset of motor symptoms, thereby extending quality of life. The most effective therapy for Parkinson's disease is levodopa, which is converted to dopamine in the brain. However, because long-term treatment with levodopa can lead to odious side effects, such as a shortened response to each dose, painful cramps and involuntary movements, its use is often delayed until motor impairment is more severe. Levodopa is frequently prescribed together with carbidopa, which prevents levodopa from being broken down before it reaches the brain. Co-treatment with carbidopa allows for a lower levodopa dose, thereby reducing side effects. In early stages of Parkinson's disease, substances that mimic the action of dopamine agonists, and substances that reduce the breakdown of dopamine can be very efficacious in relieving motor symptoms. Unpleasant side effects of these preparations are quite common, including swelling caused by fluid accumulation in body tissues, drowsiness, constipation, dizziness, hallucinations, and nausea. Further to this, in the most advanced cases, surgical intervention is possible, and research into the use of stem cell, although controversial, is very worthwhile indeed. General lifestyle changes, rest and exercise, physiotherapy, occupational therapy, and speech therapy may also prove beneficial. Now read question 11. Now listen and answer question 11. Although Parkinson's disease progresses slowly, it will eventually affect every aspect of life, from social engagements, work, to basic routines. Accepting the gradual loss of independence can be extremely difficult. Being well informed about the disease can reduce anxiety about what lies ahead. Many support groups offer valuable information for individuals with Parkinson's disease and their families on how to cope with the disorder. Local groups can provide emotional support as well as advice on where to find experienced doctors, therapists, and related information. It is also very important to stay in close contact with healthcare professionals to monitor the progression of the disease and to adjust therapies to maintain the highest quality of living. That is the end of part B. You now have 2 minutes to check your answers.